Dear students, once again welcome to my channel. Today I am going to crack one more MCQ. The question is, a 30-year-old woman in the third trimester of pregnancy is positioned supine for a scan. There is compression of the inferior vena cava which leads to reduced venous return. What reflex response is most likely to occur in this case scenario? The options are A. Increased heart rate via Bainbridge reflex. Option B. Decreased heart rate via Mary's law. Option C. Increased heart rate via baroreceptor reflex. Option D. Decreased heart rate via Bainbridge reflex. First, we will see what are all these cardiac centers present in the brain and spinal cord for the control of heart rate and blood pressure. First, we are having this RVLM. RVLM is rostral ventrolateral medulla. Next, this is caudal ventrolateral medulla. These are the two main centers which are present in the brain for the control of heart rate and blood pressure, and in the RVLM is present a structure called as vasomotor center. This is mainly responsible for controlling the vasomotor tone of the blood vessels. And then we are having the nucleus tractus salutatorius, which is the nucleus of 10th cranial nerve, vagus nerve. And any input, baroreceptor input, that is from the pressure input from the blood vessels, it first passes through the nucleus tractus salutatorius, then it sends impulse to CVLM, and it passes to RVLM. Then from the RVLM it passes to the IML, that is intromediolateral column of the spinal cord. This intromediolateral horn of the spinal cord is mainly concerned with the sympathetic and parasympathetic innervation of the heart. So from this the impulse will be going to the blood vessels and the heart. In the blood vessel, it causes vasoconstriction. So we have to know what are the main centers are RVLM, NTS. In RVLM is present the vasomotor center which controls the vasoconstriction of the blood vessels. So we are going to see in our next slide what is going to happen to these centers in increase or decrease in blood pressure. First, we will see what is Bainbridge reflex. So, in Bainbridge reflex, the trigger will be the increased venous return. The increased venous return, what it will cause is, it will cause the stretching of right atrium. So, the stretching of right atrium leads to activation of stretch receptors which are present in the right atrium, which leads to the stimulation of sympathetic nervous system, and the output is the increase in heart rate. So what is Bainbridge reflex is, whenever there is increased venous return, it will lead to stretching. That stretching will lead to stimulation of sympathetic nervous system, and it will lead to increase in heart rate. So the stretch receptors are stimulated only during increased venous return. So the trigger here is increased venous return. So this explains the Bainbridge reflex. So the Bainbridge reflex is diagrammatically represented here. It is showing the SA node, and because of the venous return, we will be having a heart rate. So whenever there is stretch in the right atrium, that is because of increased venous return, it leads to faster heart rate, and more stretch, the faster will be the heart rate. So from this, it is very clear that Bainbridge reflex, increased venous return leads to increased heart rate. So in this slide, we are going to see what are baroreceptors. Baroreceptors are present in our body in aortic arch and carotid sinus. So as the name implies, baroreceptors are receptors which senses the pressure in the blood vessel. It can be either increase in blood pressure or decrease in blood pressure. So whenever there is change in the pressure, these receptors are stimulated, and the afferents are carried by the, when there is increase in the or decrease in the pressure, the carotid receptor, it is carried by the ninth cranial nerve, and the from the aortic receptor it is carried by the 10th cranial nerve. So it is evident from this, whenever there is increase or decrease in the BP, the impulses will be sent to the centers, and from the center through the sympathetic and parasympathetic, the heart rate and blood pressure will be regulated on the basis of the signals received from the baroreceptors. So in this slide, we are going to deal with what is baroreceptor reflex. So there is, when there is increase in BP, this is sensed by the baroreceptor which are present in the aortic arch and the carotid sinus, which are the impulses are forwarded to NTS, CVLM and RVLM. We already know that the vasomotor center is present in the RVLM. So whenever there is increase in BP, it will inhibit the vasomotor center. So the vasomotor center in turn through the intermediate lateral column of the spinal cord, it causes vasodilatation of the blood vessels, which leads to decrease in BP, and also it causes the inhibition of sympathetic output to the heart, which decreases the heart rate and stroke volume. So the increase in BP is followed by decrease in heart rate and decrease in BP. It is happening vice versa whenever there is decrease in BP. So this is the relationship between the baroreceptors and the RVLM. So explains well the baroreceptor reflex. So keep in mind the baroreceptor reflex, that we will go to the Mary's law. Mary's law states that heart rate is inversely proportional to the blood pressure. So whenever there is increase in blood pressure, the heart rate decreases through the baroreceptor activation, and whenever BP decreases, there is increase in heart rate. So this is called Mary's law. It is better illustrated by this graph. So where there is inverse relationship between the heart rate and mean arterial pressures will explain by Mary's law. And this is a comparison table of these reflexes. First, vein bridge reflex. The first trigger is the increase in venous return or increase in right atrial stretch, which is sensed by the stretch receptors. So the afferent is the vagal afferent, and efferent is the decreased parasympathetic and increased sympathetic tone, and final result is increase in heart rate. So example for this vein bridge reflex, or when will be the vein bridge reflex will be activated, is whenever there is IV fluid bolus, rapid IV infusion, which leads to increased venous return. Then coming to the baroreceptor reflex, we all know the baroreceptor reflex is the trigger is either increase in BP or decrease in BP, and afferent or 9th and 10th cranial nerve, and efferent response is change in the heart rate, and maintains the BP is the effect of the baroreceptor reflex, with maintains the BP with the normal range. And example is whenever we stand up from a lying down position, this baroreceptor reflex is very important for maintaining our normal BP, and also it gets activated in hemorrhage. And coming to the Mary's law, this is just an observation. Heart rate varies inversely with the arterial blood pressure, and it is activated through, it is the Mary's law acts through the baroreceptor reflex. So the example is whenever there is hypertension, there is reflex bradycardia, and then whenever there is hypotension, there is reflex tachycardia. So from all this explanation, now it will be easy for us to find out the correct option. So from this case scenario, because of the supine position, there is compression of inferior vena cava, which lead to reduced venous return. So reduced venous return will not be a trigger for vein bridge reflex, because for vein bridge reflex there should be increased venous return. So from this we can rule out the option A and D, since it involves a vein bridge reflex. Then coming to the options B and C, the reduced venous return will definitely leads to decrease in BP. The decrease in BP will be detected by the baroreceptor, and below the baroreceptor, the heart rate will be increased as a compensatory mechanism. So we can rule out this B option because it shows decrease in heart rate. So the correct answer is increase in heart rate via baroreceptor reflex. So in this question, it is very clear that because of the compression of IVC, decreased venous return, through the baroreceptor reflex activation, there is increase in heart rate. Bonus tip is about the Cushing reflex. The intracranial hypertension can causes a Cushing reflex whenever there is systemic BP falls below less than 60 millimeters of mercury. This Cushing reflex comes into play. So the increased intracranial pressure causes vasoconstriction, which will cause the decreased blood flow to the brain. This can cause respiratory suppression, and there will be a sympathetic activation which leads to hypertension, and because of the increase in stretch and increased baroreceptor file, there will be increased parasympathetic activation which leads to bradycardia. So this is the Cushing's triad. So you have to learn a lot about the Cushing's reflex. In my further videos, I can update the Cushing's reflex in detail. All the best, thank you, and kindly subscribe the channel for further videos.